Welcome, Your Excellencies. Welcome. Let us give another round of applause. Ladies and gentlemen, I now invite the UN Resident Representative, Dr. Siddharth Chatterjee, to come and make his remarks on behalf of our partners and other sponsors alike. Ladies and gentlemen, your hands together for Chatterjee. Thank you, Dr.
Your Excellency, the First Lady of Kenya, Margaret Kenyatta, an inspiration to countless men and women, and perhaps many, many First Ladies elsewhere in the world. Her Excellency, Rachel Ruto, Her Excellency, Ida Odinga, Honorable CS, my sister, Cicely Kariuki, Hannah Tete, the Director General of UNON, ambassadors present, my colleagues from the UN family, county first ladies, civil society partners, private sector, ladies and gentlemen. The Beyond Zero campaign, when it started in 2014, has redefined the ecosystem of what reproductive maternal child health looks like. We have seen that from 2014 to date, the fall of the national maternal mortality ratio would not have been possible without having pulled the entire issue of maternal and child health from the periphery of our consciousness, actually, down into the center of public policy. Marsabit County, 2015, first time ever after the Beyond Zero campaign, partners from the UN family, UNFPA, UNICEF, WHO came together to address the scourge of maternal mortality in 6 of the highest burden counties. So its first C-section operation happened then. And these don't happen in isolation. It is because of a collective resolve of political will, of convergence of good public policy, and finally, the primacy of good partnerships spanning the public and private sector, which started to make incredible differences and incredible change. The government of Kenya has invested huge political capital in putting the Big Four agenda up in front. Universal health coverage will be key to the development, prosperity, and the advancement of Kenya's true economic potential. But the primacy of sexual reproductive health and rights will underpin all this, simply because without the decision-making capability of a woman, without a woman's control over her own sexuality, without a woman being able to decide how many children and when to have her children, she will not be effectively be able to contribute to the workforce of the country. And when she's able to do that, we will start to see household incomes improve. That will help to improve improved educational, nutrition, other outcomes. The Beyond Zero campaign is putting a spotlight on issues such as the traditional harmful practices, such as female genital mutilation, early marriage. It has started to address issues of obstetric fistula. We have to put the spotlight on the challenges the adolescent girl faces, from teenage pregnancies to a spike in HIV rates amongst them. Madam First Lady, it is the resolve of the UN family to join with you and work with you to ensure not just the success of the Beyond Zero campaign, because without that, we will not achieve UHC in this country. The marathon is very significant. It is significant for multiple reasons. One of the things that kills women at childbirth is also hypertension. Some of the challenges that women face is related to obstetric diabetes. And what we need to be addressing also is the scourge of non-communicable diseases which is accompanying the Kenyan population, and particularly women, and making them very frail and indisposed. Therefore, the run also represents a healthy lifestyle and the promotion of a healthy behavior. And therefore, it becomes even more crucial for us to really embrace the whole idea of the marathon and translate that into effective, good, healthy behavior. Madam First Lady, the UN country team in Kenya has come up with a UN Development Assistance Framework from 2018 to 2022. This UN Development Assistance Framework, which is a $1.9 billion framework, has underpinned the whole importance of UHC in that. And within that, you will find the primacy of reproductive, maternal, and child health has been absolutely ensconced and foundationally put there so that we are able to equip ourselves to support you and the government of Kenya to achieve universal health coverage. As we've seen all over the world, whether it's the Asian tigers or whether it's Western Europe, countries that progressed, leapfrogged their economies, did so when there was equality of genders and when they achieved universal health coverage, when they made sure that that sexual reproductive health and rights was inviolable and protected. Today, Kenya is at a crossroad, at an inflection point. The Blue Economy Conference also demonstrated Kenya's innate ability to bring together the entire world around a new frontier of Africa's economic renaissance, a frontier of a multi-trillion-dollar enterprise. But without women in that workforce, without women contributing to that workforce, we will not be able to make a difference. And therefore, again, the bottom line comes down to the importance of what the First Lady of Kenya is trying to do. Thank you, Your First Lady. We are at a period of the 16 days of advocacy, of the 16 days of activism around ending inequality, around ending the scourge of sexual and gender-based violence. The timing not only coincides with the International Day of Disabilities, but it also coincides with a season where we all as men need to stand up with you, collectively join you in standing up for equality and rights. God bless you, Your Excellency, the First Lady of Kenya. God bless the President of Kenya, and God bless Kenya.